So here we go. I apologize for that. Okay, again, we're going to restart this. Welcome to today's Lunch and Learn. Today we'll be focused on the point of care clinical tools and apps. My name is Katrisa Gardner. I'm the Public Services Librarian located in the South Georgia campus in Moultrie. And joining me today is also Matt McNillis, and he's the Public Services Librarian in the Philadelphia campus.
Hi, everyone.
So today we'll be giving you some point of care clinical tools that will be very helpful and useful for you during your clerkships and some apps also that will be very handy. The first one here that we're going to discuss is Dynamed. Dynamed provides evidence-based, clinically organized summaries, and these summaries are based on the review of over 500 core clinical journals and systematic reviews. The next resource is BMJ Practice. This is a clinical decision support tool that offers a step-by-step approach to help manage patient diagnosis, prognosis, treatment, and prevention. Another resource that we will share with you is UpToDate. This is a peer-reviewed clinical information system that supports point-of-care decision-making. And lastly, we will cover some apps that will be very beneficial for you. Okay, so now I'm going to navigate over to our website. And our website can be found at pcom.library.edu. Let's try that again. All right, so this is the home page to the library, which many of you may already be familiar with. So to get to the clinical tools that we're going to discuss, there's an option under the quick links. Under that, you'll see the link for clinical tools. So I'm going to click here, and I'm going to cover Dynamed. And as you can see, under clinical summaries, you scroll down here, and there's Dynamed. So we're going to click there to access it. And I apologize, the network on campus today is a little bit slower than usual. Let me click out and try it one more time. Okay, let me see if I can access it another way. I'm going to go in through databases, click on D, and scroll down for Dynamed. Okay, so the network is still slowly opening.
I know it'll start working as soon as I suggest this. Do you want me to share my screen, and then you can talk, and I'll try and point and follow along?
Let's see if that works. Thank you, Matt. I'll
All
stop
right,
sharing.
no problem. All right, we'll go ahead and present my screen now. All right, are we seeing Dynamed?
Yes, I can see it.
All right,
Okay.
awesome.
All right, so this is the homepage of Dynamed. As you can see at the very top, there are different ways that you can search. You can browse by specialty. If you click there, there are over 28 specialties. For example, if you want to focus in on a particular specialty, you can click on that specialty to view it. Um, there's another way you can search the search box there. If you want to click there to search for condition or disease, you can click there. We're also going to cover the drugs A to Z menu, drug interactions, the differential diagnosis, calculators, and I'll tell you a little bit more about some other features in the end. So starting off here, I want to go back to the specialties. And let's just say we want to focus in on psychiatry. If you click there, you can click on psychiatry and it gives you other disorders within this field. So let's just say we want to focus on depression in children and adolescents. We can filter it down to that specific area. Okay. And once you click on there, you'll see there's overview and recommendations for it. There's all types of other subjects located on the left side of the page. You can view the different headings if you want to focus on the management of the disease. You can look at the prevention and screening. You can get really specific and go down to looking at quality improvement. There's guidelines and resources for this that you can view as well. And then there's references that you also have access to over the information that's been presented to you. So that's one way that you can gather information on a particular specialty, condition, or disease. The other way, if you go back to the main page, is to go into the search field. Um, let's just say we want to search for hypertension, for example. So we can click there, and you see it says go to, and then it says search for. If there's something specific that you may want to focus in on, such as hypertension in children and adolescents, or if you just want to view the topic in its general state, you can click on hypertension, which we'll do for this example. All right, so again, this is the same page. It looks just like it did when we clicked on the specialty for psychiatry. There's the topic with all the different sections on the left side of the screen. If there's images available for the topic, you will see the images and they give you the number of images. And also the updates. If you click on updates, this will provide you with the latest information as it relates to studies or research that may be out on the topic. And what's a really nice feature here, over to the right side of the screen, you'll see a little circle with a plus. So let's say this is a topic that you want to follow. If there's any latest and greatest information on it, and you just want to get new information that comes available, if you click on follow, once you have created your account, it will populate the information on the main page, or you can opt to get the email notifications for any new information on the topic. So that is essentially how you would search for different conditions or diseases within Dynamed. If you click back on the main page, we're going to look at the next section there, the drugs A to Z. Now, this is a list that provides drugs on from A to Z and explains the drugs and how they particularly work. For example, the one that I had for this presentation review was albuterol. So we're on column A. If we scroll down to find albuterol, okay, so this tells you about the particular drug here, and it gives you the class. If you click over to the left, it gives you more about the dosing information, the safety of the drug. If you're looking for the dosing in adults versus pediatric, it will definitely give you over to the right. It provides that information as well. And then if there are any drug interactions or adverse effects, precautions, so forth, you can access the information over to the left. Patient education is important. Okay, so it gives you some clinical teaching features here where you can explain information to the patient. So that, real briefly, is the drugs A to Z um, tool. The next one at the top is the drug interactions tool. So this tool here, it allows you to check for potentially harmful drug interactions, supplies you with useful clinical information on how to manage potential effects. So, for example, if you type one drug in there in that field and another drug, it will check for the interactions. And the example that I had provided was aspirin and prednisone.
Sorry, I'm not a very good speller.
It's okay. We could pick whatever populates me. I appreciate your help since my
What,
presentation wasn't working. It's
what,
okay.
what was the second one?
Um, prednisone or
We'll just go
whatever
with,
comes
yeah,
up. Yeah,
whatever goes
whatever
with it.
comes up that works. So it tells you here at the bottom if there are any known or unknown drug interactions between two different medications. And then it gives you that information. So that's how the drug interaction tool works. Okay, moving back to the top of the page, the next one is the differential diagnosis. Now, this is provided by Isabel, which we are subscribed to as well. So, essentially, this tool allows you to get the signs and symptoms by performing a patient diagnosis differential. So, you'll basically do a clinical workup over to the left and put in different information. Let's just say we have a patient ages 6 to 12, male, and we can go down to the clinical features there and type in some symptoms that the patient may be displaying. For example, maybe a fever, chills, or sore throat. Okay, and once you type in whatever symptoms that you see that the patient is experiencing, click on Get Checklists, and it gives you the top. It shows you the 10 possible um, diagnoses. So you can click there, and once you click on whatever one of those fields you want to explore, relapse and fever, it takes you back to Dynamed. And so you'll see the same particular format. It gives you the information from Dynamed that you can continue to look at the general information and the different sections to look at this particular diagnosis. Okay, so that's the differential diagnoses. The next thing is the calculators. Briefly, there are over 650 calculators that Dynamed provides, and this is in collaboration with MedCalc. You can view them by A to Z, over to the right there or in the center of the page, or to the left there side of the screen, you can view them by type. So those are available within Dynamed as well. Um, so that's essentially Dynamed. Don't want to take up too much time because we had some technical issues in the beginning. So Matt, I'm just going to turn it over to you.
Okay, cool. Thanks, Katrisa. Yeah, so
Thank you.
that, as Katrisa had mentioned, that's Dynamed. We want to touch on two more point of care tools today. It's going to be BMJ Best Practice and then UpToDate as well. So I'm going to go through those two. So where I'm at, I'm back on the homepage of the library website. Katrisa had pointed out a good way to get to those is with our clinical tool guide, which is going to be up here. We have a myriad of ways to get to these databases. So you have plenty of options. You can go the clinical tools way. We do have the A to Z database list, which Katrisa had also shown how to access that. So with BMJ, obviously you would go to B and do it. We also, on the main web page under quick links, we have a mobile apps guide as well, which we'll go to and mention as well at the end. You can also access it that way, but we'll save that to the end. So let's say we'll do databases, head to B for BMJ Best Practice, which is going to be right here. So we're going to go ahead. I already logged in, made sure I could log in. So we're already there. And this is going to be the main website for main page for BMJ Best Practice. The way you sign up for this, you're going to have to sign up for an account independently on your own. That your single sign-on from PCOM won't quite cut it for this. So you will have to sign up with your PCOM email, and then you can go ahead up here in the top right-hand corner, and you'll be able to log in with that as an independent account from your PCOM network credentials. The account section in BMJ is pretty basic. It really just gives you your general details about your subscription and doesn't really offer you too much, updating your credit card. But you don't have to do that because this is free because you're a PCOM member. So nothing too much with BMJ's account options. The website, though, the front page looks probably fairly similar to Dynamed for the most part. You do have your large search box, which we're going to search for our conditions and symptoms. And then you do have a lot of the bells and whistles here. And I think this is one of BMJ's strong suits, is all of the extra things they have available for you outside of just finding out about whatever you're searching for. Their recent updates page, I think, is really well done. It gives you updates by date, so you can look, the most recent things, updates of the past week or so. You can look for important updates that they've decided to kind of curate, so you can see all of a sudden it doesn't include as much, but includes the important updates, and then of course also updates by specialty, like Dynamed has, which was nice. But I really like that they have updates by date, so you can just kind of check like what's going on, and then it kind of shows what topics they have a recent update. So I think that's a strong suit of BMJ. Heading back, the specialties, just like in Dynamed, you can search via specialties. We won't take too long with that. Calculators is going to be the same thing, just like Dynamed, like Katrisa had shown. The calculators are here. You can search either A to Z or by specialty, which is nice. Again, another strong point of BMJ Best Practice, you can actually search for the calculator you're looking for. So if you know what you're looking for, it's really nice to just punch it in the search bar as opposed to having to scroll like Dynamed and like UpToDate that I'll show you in a little bit. So the calculator option there and available. We'll skip patient leaflets because I think that's an important one. BMJ also offers a video section, which I think is really nice, a really nice addition over what Dynamed and especially what UpToDate have. Their video library is not very comprehensive. I think they might have 30 to 40. Like this is about it. But I think it's just a nice addition and a different medium to not only learn from, but potentially show patients as well. So a couple basic procedures that they have here in video form, which again I think is a neat addition. So that's something that BMJ has, I think, is a good addition. They do have an evidence page if you're more interested in evidence-based medicine. Heading into that, they actually are synced up with Cochrane Clinical Answers, so you can head into Cochrane and do some work in there if you're looking for something more EBM related. So that's a nice feature as well. And then over here with the drugs information, very similar to Dynamed, and UpToDate has this as well. They do have a drug database. Theirs is actually hooked up with the American Hospital Formulary Service, the AHFS, clinical drug information. So you can go ahead and search that. So BMJ, kind of like Dynamed, pairs with a lot of different databases to bring you good information, which I think is pretty helpful. So you can go ahead and look up whatever drug information you need through the HFS. And the last thing before we actually do a search, I want to mention is the patient leaflets. Again, I think this is another area where BMJ really shines, is with these patient leaflets. We're going to go ahead into it. Again, you can search A to Z, or you can just type in what you're looking for in a search bar, which is nice functionality of that. We can just look very quickly at acute kidney injury. And what you get when you click on that is just a nice, clean, like 3 to 4 page PDF to give to your patients. I think this is really helpful, and something where BMJ really shines is that it's nice, it's readable, it's not in really complicated language, so patients are going to be able to digest this and be able to benefit from it. Like I said, very brief. What is acute kidney injury? What are the symptoms? What treatments work? And what will happen. So I think this is really helpful and something to be able to give to patients, about whatever malady they're suffering. That BMJ has something that's nice, clean, short, and digestible for the patient. So again, another area where BMJ shines. That I think a lot of their bells and whistles are really great. I would say that BMJ has a lot of breadth of information. The only problem with BMJ, I think, is when you actually go to search for something, is where I think it falls a little short. So for instance, we'll go ahead and search in here. We'll search headache. It's nice, simple. and it'll take you, to your search results. It is nice. They do offer on the right-hand side here some differentials, so some different things you can look for, a brief summary, some guidelines, the patient leaflets, which again is helpful. If you're searching this way, you can still get access to the patient leaflets, and then any of the videos. If you're, searching for headaches, the videos are right there, which comes up, which is also very helpful. And then just your list of possibilities when you type in headache. One thing the BMJ doesn't have, it doesn't have as good of a filter as what UpToDate and Dynamed have. So you might have to search, like if you're looking for, headache in adults as opposed to headache in children, you can't limit it while you're searching. So when we go ahead and click into the actual condition, uh-oh, now my internet's going to go slow. Oh, there we go. Okay. And this is going to be the main page. We saw this with Dynamed. Dynamed is a lot more comprehensive, as is UpToDate, because BMJ is a lot shorter in terms of what information they have. They have the summary here. They do include differentials, the leaflets, the guidelines. Up here is where you find more information that we saw with Dynamed with all of those columns is going to be available here, whether it is through the theory, through emergencies, if a headache is very serious or presents something more sinister than just a headache, your diagnosis. So they still offer this type of information, but it's a little bit more cumbersome to look through because you have to start clicking to get to it. So for instance, we go into emergency, urgent considerations. And you have to see here, then it displays the information. But again, I don't think this is quite as comprehensive as what Dynamed and UpToDate does. That's why I said that BMJ, I think the breadth of information is really good. I think the depth is where it lacks a little bit. But I do think this is a really worthwhile tool because of the updates, the calculators, the leaflets, the videos, the drug database being linked up to HFS, and the evidence being linked up to Cochrane. I think it's a valuable resource. I just think you kind of have to pick and choose depending on what you're looking for. So that's BMJ. We'll head over to UpToDate because I see we're running a little short on time. So I would normally go back to the database page and clicking on UpToDate. On U for UpToDate. And this is going to be where the main page for UpToDate. If you see I'm logged in up in the top right, my account is here. One nice thing with UpToDate is it actually has a history of what you searched for, your most viewed items, and then you can also bookmark different conditions as you're searching so that you can, quick referral, which is really nice. And I think adds a lot of convenience to having an account and going through and using UpToDate on a consistent basis. UpToDate, like the others, have their big search bar right here in the front. However, up here on the top, you see calculators available again, just like before. UpToDate also has a search bar, which is very helpful. The drug interaction section, Katrisa led you through this with Dynamed. UpToDate's partnered with LexiComp, which is nice. So the same thing, you type in your drugs and then you'll see the interactions there, which is helpful. So they offer that. And then the contents is where they offer some more information, which can be a little tough to find. It's not quite as prominent as what BMJ and what Dynamed was. So that's a little bit tough for UpToDate to navigate this website. You can see what's new section. So just like the others, you can find out what's going on. This, again, I think is lacking a little bit in terms of usability because you have to start searching by topic. There's not just like a date, what happened May 15th or March 15th, there was an update, March 8th, there was an update. You have to go search for a topic to find out about the updates. So I think that's a little lacking for UpToDate. Drug information as well as here. Again, I think a little lacking as well, not quite as searchable or as user-friendly that you have to kind of dive into these different sections to find out what you're looking for. So a little bit more work has to be done to be able to get to drug information. And then have topics by specialty, you can search just like Dynamed and BMJ. And the patient education section, again, I think this is a little bit more lacking than what BMJ. I think BMJ does this a little bit better. That with the patient education, they do offer like a basics section and then a beyond the basics section. So pending your patient, level of comprehension with this stuff, you have to click into a topic and kind of scroll as well. So it's not quite as user-friendly, like I said, as what BMJ does. But when you do go into these things, they do offer decent information. but it doesn't feel as clean or as easy to access as what BMJ does. So that's where I think UpToDate is a little bit different. I don't think UpToDate has the breadth of information and the versatility that something like BMJ or Dynamed has, but I do think one place where UpToDate does shine is going to be the depth of information. So we're heading back to the main website. Search bar is right there. We'll do headache, just like we did with BMJ. And when we get our search results, we see up here that you can actually limit it to adults, limit it to pediatric. You can actually limit it to patient education, and then you can also edit it to graphics as well. UpToDate does offer graphics, but typically it's going to be more in as tables and graphs as opposed to pictures and videos, something that both Dynamed and BMJ had. So a little bit more bare bones, but where UpToDate I think shines is just in the information itself. We'll go ahead, click on evaluation of headache in adults. And this is where you get a ton of information. Just like Katrisa had mentioned with Dynamed, on the left here, we have the classification, an introduction, your evaluation of it, and everything that you might need to be able to work with this condition. And then towards the bottom, has the information for patients, summary and recommendations, acknowledgments, references, and then the graphics as well. And then you drop down even farther, it goes to your related topics. So this is where you can kind of browse a little bit and kind of form your own journey going from there. So that I realized that was pretty quick, but that's UpToDate. Again, I think UpToDate is a little bit more basic than what BMJ and Dynamed are. So it probably depends on your style and your preference. But again, I think UpToDate, the information itself, I mean, I'm going to start scrolling. They have a ton of information. So that's why I think BMJ has the more breadth, where UpToDate has more depth in terms of information, that they just have so much here for you and available. And in terms of with UpToDate, with BMJ, and with Dynamed, they all have mobile apps that you guys can access. So we're going to head all the way back to our main library page. Just like I promised, we'll touch on the mobile apps. If you are on the main page, we have a quick link section that is right here, and there's going to be a mobile apps guide for you. And this is going to include not only BMJ, Dynamed, and UpToDate, but all apps that our PCOM library resources offer. So whether it be, Access Medicine, Anatomy TV, I believe we have Draw to Know It on here, Visualdx. This is definitely a good place to look, for what your app needs are in terms of resources, so you can take your resources on the go. And like I had mentioned, BMJ is available right here. We see, it's in alphabetical order. Dynamed's going to be available, and then UpToDate is going to be down here. Like I had mentioned with BMJ, you have to sign up for your own separate account. Dynamed, I also believe that's the case. Katrisa, feel free to jump in and correct me if I'm wrong.
No, that's correct.
Okay, good. Dynamed, you have to sign up for your own account. Once you do that with those two products, then you can go ahead and download the app, and then you enter in your credentials once you're already verified, via BMJ and Dynamed to get into the app. UpToDate works a little bit differently. UpToDate actually uses our single sign-on. So your PCOM network credentials will get you into UpToDate and will get you an account, which is really helpful. There is a little bit of legwork with UpToDate. When you do download the app, there is an Open Athens login option. And by doing that, when you go in, Open Athens is our authentication system for library resources. You have to search, make sure you find the PCOM's name in that, and then you enter your Open Athens, so your PCOM network credentials, and then you'll be in for Open Athens, for UpToDate, excuse me, when you sign on. So it's really helpful that you don't have to remember yet another password, but you do have to do some legwork in the beginning. And at least regarding the BMJ app and the UpToDate app, the BMJ app is actually fairly different from what we looked at on the website. So I would caution you when, going from the website to the app, it's different. Things are laid out different. So there is a learning curve to it. UpToDate, on the other hand, what you saw on the UpToDate websites, pretty much what you get in the app as well. Nice, simple, no bells and whistles. It looks very similar. So if you're used to using the website, when you open the UpToDate app, it'll be pretty similar, and you'll feel pretty comfortable right away. Where BMJ, it's going to take a little bit of work to try to get to everything. Katrisa, any thoughts on the Dynamed app and the usability? I think it's probably right in the middle in terms of how user-friendly it is as opposed to the website.
Oh, yeah, it's definitely user-friendly. Everything you need to access what you need on the go, it's pretty much in line with the others. It's really good.
Okay, cool. Yeah. So those are the apps, and then just a final point before we say goodbye. We do offer some apps for graduates. So I know this session is probably going to be mostly for folks who are heading out into their clerkships. So you still got a couple of years. You're going to be with PCOM. Once you do head to the alumni area, once you graduate and become an alum, we do offer a few apps that you guys can still take advantage of after you graduate, and that's going to be available in the alumni portal section. So we're on the main page here, down to alumni portal. And we do offer a few apps. One of the two big ones that I really want, three big ones I want to mention: RefWorks, Mango Languages, which is great, and also Dynamed. What a coincidence. That's great when these things work out like that. That once you become an alum and go out and start practicing medicine, you still have access to Dynamed, which is great. Your login credentials will change, going from a student to an alum, but you still do have access to Dynamed, which is a great feature for alums that we can offer. So, well, Katrisa, I think we touched on everything there in all of our apps in 30 minutes.
Yes.
I'm not sure if there are any questions in the chat, but we'll leave that for about a minute. But if not, Katrisa, any final words from you?
No, just I guess we could show them how they can reach out to us if they're having any issues.
Yeah, that's a great
Contact
point.
us.
Yeah, good point. Thank you. So we're on the main page, about. We have a staff directory. Myself and Katrisa, we can be in the same screen. Katrisa's contact information is right there. My contact information is right here as well. Although if you have questions, if you reach out to literally anybody on this page, we would be happy to help you or point in the right direction. So please don't be shy if you want to reach out to anyone on this list, and we'll be happy to give you any assistance, whether it is with these apps or anything else. I mean, I guess library or PCOM related, we can certainly help you out. So, all right. Well, thank you everyone for joining us. And like I said, if you have any questions, please feel free to contact us. Otherwise, thank you and have a great day, guys.
Thank you.